Welcome to the Upper Valley Chronicle, brought to you by the Vermont, New Hampshire VNA and Hospice. I'm your host, Ann Holmes. This is our third and last show from one of the three premier assisted living facilities owned and operated by Terrace Communities in Vermont. Catherine Almirante from Valley Terrace joins us to tell more about the hospitality and care services offered to the residents here. Leonard Brown from Bugbee Senior Center has a story to tell about the vibrant and popular Center for Seniors. Marilyn Bourne, the executive director of Listen, shares the exciting news about Listen's new building and the campaign that is helping them finish the project. And Bob Ellis from the Visiting Nurse Association of Vermont and New Hampshire and Dr. Brian Lombardo share their complex care pilot project with us, an example of a program to enrich the lives of hospital patients in the Upper Valley. When we return, we'll talk to Catherine Almirante of Valley Terrace. First, these good words from the good businesses that make your Upper Valley Chronicle possible every week.
Looking for something to do? Find the most interesting people, local events, and unique businesses with Upper Valley Life. Upper Valley Life takes you up and down the Connecticut River, covering the community in which you live and all that makes it special. The magazine brings the Twin State region to your doorstep with award-winning local coverage. Find out more at uppervalleylife.com. Rediscover your hometown and this great area we live in with our family of publications. We want people around us who care, people who take the time to understand what we need. The staff at the VNA of Vermont and New Hampshire provide the best medical care and much more. Sometimes what matters most is a sign that someone is listening, a friendly smile, or a gentle touch. The Visiting Nurse and Hospice of Vermont and New Hampshire. People heal better at home. Let us help.
My guest right now is Catherine Almirante. Catherine is the executive director here at Valley Terrace. And first of all, thank you for letting us film in this beautiful living room.
You're absolutely welcome. It's our pleasure.
Lovely facility. But you know, you're one of a family of residences called Terrace Communities.
That's right.
Tell us a little bit about that.
Terrace Communities is a group of assisted living homes. There's 7 buildings. 1 in Florida, 2 in New Hampshire, 1 in Maine, and 3 in the Upper Valley area. And then there's 1 in Manchester, Vermont.
Wow.
Yeah.
And what is the sort of overriding philosophy of Terrace Communities? I mean, what makes you sort of a family of residences?
Yeah. Well, I think it's unique in that it is a smaller company of this kind of long-term care. And what I have learned is that they really encourage each building to have its own personality. We're all different sizes. We really reflect the personality of the community. And everyone has a different, experience when they walk into a building, has a different feel. Mm-hmm. And, overall, the philosophy is we have a beautiful building, but if the care is not reflected as also beautiful and wonderful, it doesn't matter. You can have the most beautiful paintings and curtains and that kind of thing, but it really gets down to high quality care, and that's what I love about it.
Yeah. And you have how many residences here?
Here at Valley Terrace, we have the capacity for 71. There are 61 units, and we could, little apartments. We have couples who come in, and then we have room shares if for either financial reasons or social reasons people want to be together.
Want to live together, yeah. And we just saw a little doggy walk by. People are allowed to bring their pets.
Absolutely. So we have some folks who visit with either the pets that were at home with them, or you are certainly allowed to have cats or dogs. We make sure that they're up to date on their immunizations and all of that stuff. There are some rules around it, but it's really, really important for folks when they're making what's already can be a difficult transition to bring their lovely pets with them.
Yes. And so what sort of services do you provide? People live in the little apartments or the rooms?
Yes.
And what else do they get when they are a resident here?
So they do have their own apartment, and it is, their private space, just like you would rent an apartment anywhere. There's a variety of services. A lot of people come here when they're ready for, they may be isolated at home. They just want to be with other people. And so the services range from really the basics of having your meals prepared for you, housekeeping, laundry, all the way up through end-of-life care, basically. So we also provide transportation, which is a huge issue for older folks sometimes when they lose the ability to drive, being able to get to medical appointments, shopping, and all that kind of thing, and we can provide all of that.
Yeah, and do people come for short stays?
They do, yes. We provide respite. We just have a new fellow here who's here just for about a week while his wife has some medical procedure done, and it's perfect. He, gets to be in this environment, and he's not worried about her, and she's not worried about him, and yeah.
And the family's not worried about it.
Exactly,
yeah.
Exactly, yeah.
And I know we passed on the way in your pretty dining room, so people
Yes.
can either eat in the dining room or eat in their own homes?
They can. We will provide room service. Most people want to come to the dining room, certainly if they're not feeling well. We provide it in their rooms. But for the most part, that's a big social part of their day, 3 meals, and then we have the country kitchen where they can have snacks and other social gatherings. Yeah.
And then what kind of care is provided for people, when they need medical care or they need some real help?
Right. Well, there's always someone here, 24 hours. There's someone here. There's nurses on most shifts, LPNs. So we can provide, really pretty much most basic nursing care. We're not a nursing home. It's a very different level of care. But certainly, personal care, help with ambulation, bathing, dressing, those kinds of things. And then, managing people's medications. We provide, one really important piece is as a liaison with a doctor.
Yeah. It's a full service.
It is. It really is. So we have podiatry comes in, psychiatry comes in. We really are allowed to do a lot here. It's really nice.
It's very nice.
Yeah.
Catherine, thanks again.
Oh, thank you.
Check out Valley Terrace and Terrace Communities, beautiful homes for your parents or for yourself. And thanks for letting us be here, Catherine.
My pleasure.
When we return, we'll be with the charming Leonard Brown at the Bugbee Senior Center based in White River Junction, Vermont. Now a few words from our other fine community-minded businesses.
If you have an orthopedic issue, turn to Dr. James M. Murphy, a board-certified orthopedic surgeon at New London Hospital. Working in collaboration with Concord Orthopedics, Dr. Murphy evaluates and treats hand, elbow, shoulder, knee, hip, and ankle fractures and pediatric injuries. New London Hospital is in your neighborhood, providing primary and specialized services in its state-of-the-art facility. To learn about our services and our compassionate doctors, visit newlondonhospital.org. New London Hospital, your prescription for living well. Simple solutions in a challenging world. Let Echo Communications make your life simpler. From the beginning, creating design, through the commercial print process, and ending with custom mailing, all easily coordinated in one place. Echo Communications provides simple solutions in a challenging world. One place, many solutions.
Our guest right now is Leonard Brown, who is the director of the Bugbee Senior Center, which is part of the White River Senior Council. Am I saying that right?
Well, White River Council on Aging.
White River Council on Aging.
Yeah. And folks are always curious as to how the two names merge. And the Bugbee Senior Center is named after a local dentist who donated some money for the building to be built. And so around these parts, it's known as the Bugbee Senior Center, but the agency name is White River Council on Aging.
And how do you guys get your funding to support this kind of an operation?
Well, we have several sources. The main source of funds for us comes through our nutrition program and federal nutrition dollars for older Americans. We also get some money from United Way. We get money from our towns that we serve, and the major towns are Hartford, Norwich, Thedford, and Heartland. And we get money from folks who come in and make donations to us. So it's an array of sources.
Yeah. And how many seniors are in those towns that you feel you can serve?
Well, last year, in our most recent completed fiscal year, we served almost 2,500 people in one form or another. So that's not the total senior population, but that's the number of people we touch.
Right. And what type of services do you offer?
Well, we have several different types of services. I always start the conversation by saying the cornerstone of our services is our nutrition programs. Last year, we served 28,000 meals. And about half of that is Meals on Wheels. And then the other half is folks coming in Monday through Friday. We have a meal every day. And roughly 50 to 60 people a day on average come in for our meals. So,
and do you guys find that's your biggest need with seniors? Is seniors not getting the right nutrition?
It's certainly a big need, along with health care, of course. But a lot of folks who are seniors, they stop getting interested in preparing foods, especially if they do live alone. It's not the same as preparing a meal for a family. And shopping can be a challenge. So those two things combined sometimes conspire to make it difficult to just plain eat right.
And tell us about the other services you offer, Len.
Well, we have what we call enrichment programs, and I like to think of them as just plain fun. If we're not having fun as a staff, we're not going to convey that what we do for the folks that come in to be fun. But we do everything from programs in the center. Right now, as we speak, there are card games going on. Hopefully there's no gambling. But who knows? We do trips. We do various things with other entities, including the schools. So we do some intergenerational things. The big thing in the summertime is we arrange a lot of trips off-site. We try to have a diverse mix of things that would interest people. From Lake George Dinner Theater, we go to Montpelier in the State House. We've gone to Maine. We just pick them based on what people tell us they might like to see us try.
And you're a former school administrator yourself.
Yeah.
Does getting the younger generation involved or acclimated to the older set, is that important to you?
Well, it works both ways. Surprisingly, the young people who come in enjoy spending time with some of the older folks. They often have no experience or exposure with older folks other than relatives. And there's a whole different set of expectations when you're with family. And for the older folks who are in our programs, it's good for them to see young people coming in, and it breaks through some stereotypes.
Right.
You know, everybody isn't listening to junk on their music box, and their pants aren't falling halfway down their backside. So we have a good cadre of students who do some things with us, including wait staff. And for a couple of years, we've been running some technology tutorials.
Wow.
And so we have folks come in and get one-to-one help with everything from iPhones and learning how to text to computers and a whole gamut of skills.
Right. Now, I know you must really see the difference that it makes in these people's lives to have this camaraderie and this good nutrition and all these wonderful trips. But do you have any data that suggests that what you're doing as a senior center enriches people's lives?
Well, a lot of it is the reports they give us. And so I realize that people objectively could look at that and say, well, that's a bit self-serving. But we are a place that provides a number of social services for people, too. We have some social service workers who help people get things like fuel assistance, sign up for their Medicare. You know, we just went through last month a period of the open enrollment for their Medicare supplemental plans. And so we see the number of people we serve in that capacity and say, if we're not doing it and no one else were doing it, those folks wouldn't get that assistance.
In trouble, yeah. Well, Len, thank you very much for being with us today. Check out the Bugbee Senior Center. Ask for Len and
come on down.
Exactly, come on down. Thanks again.
Thank you.
Our next guest will be Marilyn Bourne, the Executive Director of Listen Community Services. We'll take a peek at their new building. See you in a minute.
At H.R. Clough, we sell, install, tune, and repair home heating and cooling systems and deliver your fuel oil. But there's more to our operation than you see when we visit your home. Come visit ours and see the upgraded, expanded, and environmentally friendly fuel storage facility adjacent to our 24-hour-a-day credit card gas service. And from 6 a.m. to 10 p.m., a self-service automatic touchless car wash. H.R. Clough and Kearsarge Heating Oils. Over 65 years of local ownership and dependable service.
For those of you who can't get to the mountain today, check this out. For those of you who want to enjoy the mountain tomorrow, check us out.
At the moment, we have Marilyn Bourne with us. Marilyn is the Executive Director for Listen Community Services, and you've got quite an exciting project going on over at Listen.
We do. We have a rather large project in the White River location, right on the river, where we have about 2 acres of land, and we are building a 10,200 square foot facility to house a much larger thrift store, because we generate most of our operating revenues from our thrift store operations. A teen life skills center will have a permanent home at that location, and our community dinner program will now have its own dining hall and commercial kitchen.
Wow. So Marilyn, take us back. When and why did Listen start?
Listen was pulled together around 1972 by a group of residents in downtown Lebanon who were dealing with issues of what we now call food insecurity or hunger, as well as tenant rights. They were advocating for themselves, and they were trying to help one another. And in the effort to do that, they created this 501c3 called LISTEN, which is an acronym. It stands for Lebanon in Service to Each Neighbor. And we still use the word listen, but Lebanon is not the only community involved in this process now. It's really the entire Upper Valley, and we serve both sides of the Connecticut River. So it is really Listen Community Services. I think of it as listen in service to each neighbor now.
Right. So Marilyn, do you find that Listen has established themselves in the Upper Valley so people know where to take their furniture and their generally used clothes? I mean, how hard do you have to market to get people to give you donations?
We don't have to market much at all. We've been around for 40 years now, going into our 41st year, and the public is pretty well educated to our locations. So there are 4 convenient locations. They know the times of day. We're open 7 days a week. And so sometimes we have the opposite problem. We are overwhelmed by donations. And when it's furniture donations, people know that they can call us. We have a website, and people refer to the website, and they can call us, and we will pick up furniture. We don't send trucks for clothing, but for furniture pieces, we will send the truck.
Right. Now let's talk about your new project. It's very exciting.
It is.
And we're going to show a picture to the audience of the blueprint. But when did you decide to build it, and when will it be done?
Well, we purchased the land in 2004, and we started doing drawings and talking to architects to think about design. We're working with a wonderful gentleman from the Upper Valley, David Lauren. He was actually a past member of our board of directors. And David had some great ideas back in 2004 and 2005, and then we started to hear rumblings about the state coming in with a temporary bridge to replace that old bridge between Lebanon and White River Junction. So it slowed us down. We went back to the drawing board with David about 2 years ago, and now we have this absolutely beautiful building that will be sort of a spruce green with yellow trim.
And when will the new building be open?
We're hoping it will be finished by August. Okay. I would love to have ribbon cutting in August and start the community dinners at that location. We've been doing community dinners in the Upper Valley for 28 years. And in all that time, we've never had our own kitchen or our own dining room. We use other spaces. Some of those spaces we have to pay for, and I'd rather have those dollars go into the program.
Of course.
And some of those spaces are closed to us once in a while. So having our own kitchen and dining hall ensures the length of time that that program can exist, and it also provides our cook teams, because we work with 42 volunteer cook teams, they now have their own home.
Right, that's
where
great.
they can touch everything and cook whatever they want whenever they want. It is.
Marilyn, thank you for being with us today and
My pleasure.
telling us about Listen. Check out Listen Community Services. Support their endeavors. They're good to the community.
Thank you. Thank you very much.
Joining me after these messages from our good sponsors will be Bob Ellis from the Visiting Nurse Association of Vermont and New Hampshire. He'll be joined by Dr. Brian Lombardo, and they will be sharing their exciting pilot project about taking care of hospital patients in the Upper Valley.
Discover Ragged Mountain, where snow is just around the corner. $1 million invested in snowmaking for 2013 means more skiing and riding all season. We're home to New Hampshire's only 6-pack high-speed chairlift. Ragged Mountain, more snow, more fun, so close.
Chronicle has been providing trust, confidence, and peace of mind since 1941. And we just opened an office in Winhall, Vermont to better serve our customers. For over 70 years, Chronicle has served people of New Hampshire and Vermont with clean, reliable heating fuels. From bio-blended heating oil, propane gas, kerosene, diesel fuel, and gasoline, we're providing quality of our products and our unmatched superior service. At Chronicle, you can depend on us. We're staking our name on it.
Discover Ragged Mountain, where snow is just around the corner. $1 million invested in snowmaking for 2013 means more skiing and riding all season. We're home to New Hampshire's only 6-pack high-speed chairlift. Ragged Mountain, more snow, more fun, so close.
We have two guests joining us now, Bob Ellis, who's from the VNA of Vermont and New Hampshire, and Dr. Brian Lombardo, who is from Alice Peck Day Memorial Hospital. Dr. Lombardo is a family practitioner and medical director from the Community Care Center. Thank you both for joining us together.
Thank you, Ann.
And you are sort of working on this special project to help people transition from hospital to home. Can you tell us about that, Dr. Lombardo?
Sure. Bob came to us a couple of months ago, I guess it was, saying that the VNA was interested in running a pilot program on a more beefed up, intensive support for transitioning people from the hospital back into their homes. And we were very receptive to working with Bob on this and the VNA on it because we know that those transitions are dangerous occurrences sometimes and really sometimes really important transitions that need to take place well.
And is it dangerous? I know that there's a big focus on readmission rates, but let's talk about the patient. Why is that transition so difficult for the patient?
Well, there's always a lot of information that needs to be transmitted. There's a lot of new instructions, care plans have been changed, and patients sometimes are just simply overwhelmed. They remember what they've been doing for so long. They have a short stay where lots of things happen, and then their medicines have been changed, their approaches to what they should be doing have been changed, and before you know it, they're a little lost.
What do you put in place that makes this better?
Well, the whole idea is that we need to be intensively supporting the patients. One of my colleagues, Lisa Fermansky, who's a geriatrician, talks about it as the voltage drop that occurs when people leave the hospital. It's kind of like there's all this energy and all this support, and then they walk out the door and boom, they're on their own.
Right.
And so Bob's organization is able to bring in some of that extra voltage and keep up the support and keep up the energy.
We are looking at this more or less as a new model of care versus the traditional way that we would take care of a patient that's discharged from the hospital. in these particular types of patients, most of them have complex medical conditions. And so at the time of the discharge, as Brian pointed out, these are very fragile patients, so that the handoff from the time they leave the hospital to the time they get home really is probably the most critical point in time. So what the largest difference, I would say, is the fact that we heavily front load a multidisciplinary team to do a very, very thorough assessment on these patients. So we see them for 5 days in a row.
And do you start that in the hospital setting, or is that the first time they walk in their own door after being in the hospital?
Right. That's typically, we will speak with the patient while they're still in the hospital to make sure they understand what the expectations are and that there'll be a lot of people coming through their house for their first week, because that always surprises them. If they've been on home care service before, they may see a nurse or a home health aide once or twice a week. But this is, a registered nurse, it's a social worker, it's a physical therapist, occupational therapist, speech therapist. So there's quite a team that goes in to do this assessment, and then we go back to the attending physician and develop a care plan going forward after that assessment is done.
And does that help you, Dr. Lombardo, does that set your mind at ease that you're not so worried about these people once you're out of your care?
I mean, absolutely. It's a very, very important function. We know that those first 72 hours after discharge are really critical in helping patients make that successful transition.
Right. And Bob, I know it's a young program, but would you say you're seeing good results already, or is it too soon?
No, this is the second pilot that we've started, and we have several others in the pipeline, but the early results have been very encouraging.
How are the patients responsive? They like the...
They do. We actually do, after the study is done, so I only have one example to give, but we do both quantitative analysis of the outcomes, but we also do qualitative. And all of the patients felt that their sense of well-being was better at the time that they were discharged from the service than the time that they were admitted.
That's great. That's great. Well, thank you both for joining us. Check out Alice Peck Day Memorial Hospital and Dr. Brian Lombardo and the VNA of Vermont and New Hampshire to find out more about this program. Thank you both.
Thank you. Thank you.
Thanks for joining us in our VNA and Hospice of Vermont and New Hampshire series here at the Valley Terrace. You can see this show again by going to our website, ycnnow.com, or email me if you have a question or would like the contact information of one of our guests. We thank the staff at the VNA of Vermont, New Hampshire, and the staff and residents of Valley Terrace for putting the show together to help provide lots of helpful information to our guests. Our local news plays every night here on YCU at 6 p.m. and replays at 6:30, 10, and 10:30. Watch to stay in the know with everything happening in the Dartmouth Lake Seneca region. The Game of the Week premieres each Sunday at 10:30 a.m. and replays at 1 and 5 p.m. This week our hockey coverage continues as the Lady Raiders of Lebanon take on the Marauders of Hanover. Give me a call or send me an email if you would like to join us on Upper Valley Chronicle as a guest or a host sponsor. See you next time when we'll be filming at the Hotel Coolidge in White River Junction, Vermont. Thanks for joining me in our continued examination of all the things that make living in the Upper Valley so great.